How many pillows are you sleeping on tonight? One, two, three? Most people never think about it. But in clinical medicine, that number is one of the first things I look at. Because needing extra pillows just to breathe comfortably at night, that can be a sign your heart is failing. And that's just one of 10 things. I've spent 15 years as a hospital doctor in the UK, and I've seen how the way you sleep, the position you choose, the sounds you make, the symptoms that only appear when you lie flat, can reveal what's happening inside your body long before any test does. In this video, I'm going to walk you through all 10, what each one means, and when it becomes something you can't afford to ignore. Warning sign 1, constant loud snoring. The first sign might be more obvious to your partner than to you, constant loud snoring. And I don't mean light, occasional snoring. I'm talking about the kind of snoring that can be heard from another room, often punctuated by pauses where breathing stops, followed by a choke or a gasp. This isn't just an annoyance, it's the hallmark symptom of obstructive sleep apnea, or OSA. The real danger is what's happening in those silent moments. With OSA, the tissues in your throat relax and collapse, completely blocking your airway. For seconds, or even up to a minute, you stop breathing. Your brain, starved of oxygen, panics. It sends a surge of adrenaline through your body to jolt you just enough to gasp for air. This can happen hundreds of times a night without you ever fully waking up. Each event puts immense strain on your heart and blood vessels, leading to high blood pressure, heart arrhythmias, and a dramatically increased risk for heart attack and stroke. If your partner says you stop breathing in your sleep, or if you snore loudly and wake up with a headache or a dry mouth, it's so important to see a doctor. They may recommend a sleep study. The most common treatment is a CPAP machine, which uses gentle air pressure to keep your airway open, finally giving your body the oxygenated rest it desperately needs. Warning sign 2, waking up to heartburn or choking. Do you ever get jolted awake by a burning in your chest, or that awful feeling of stomach acid in your throat? This isn't just uncomfortable. It's a critical sign you may have gastroesophageal reflux disease, or GERD. When it consistently messes with your sleep, it's a major red flag. When you lie down, gravity is no longer helping keep your stomach acid where it belongs. In people with GERD, the valve between the esophagus and stomach is weak, allowing acid to flow backward. This acid is strong enough to digest steak, so you can imagine the damage it does to the delicate lining of your esophagus. It's a two-way street. GERD ruins your sleep, and poor sleep can make acid reflux worse, creating a vicious cycle. If you're waking up with a sour taste, a sore throat, or a chronic cough, it's time to act. Try elevating the head of your bed by 6 to 8 inches. And no, just propping up on pillows isn't as effective. Avoid eating large meals, spicy foods, or drinking caffeine and alcohol within 3 hours of bedtime. If that doesn't help, talk to your doctor about medications. Warning sign 3, needing multiple pillows to breathe. If you find it impossible to sleep lying flat and have to prop yourself up on a pile of pillows just to breathe, your body is screaming for help. This has a medical name, orthopnea. It's one of the most classic and serious signs of congestive heart failure. Here's what's happening. In heart failure, the heart muscle is too weak to pump blood efficiently. When you lie down, fluid that was pooling in your legs during the day flows back toward your chest, flooding the air sacs in your lungs. Essentially, you begin to suffocate. Sitting up lets gravity pull that fluid back down, and you can breathe again. The number of pillows you need is actually a clinical sign of how severe the condition is. We even call it 3-pillow orthopnea in advanced cases. This is not a symptom to adapt to. If you have to sleep propped up or in a recliner to breathe, you need to see a doctor immediately. Addressing the underlying heart failure is the only way to resolve this and prevent life-threatening complications. Warning sign 4, an uncontrollable urge to move your legs. As you're trying to fall asleep, do you get a creepy, crawly, tingling, or aching feeling in your legs that creates an irresistible urge to move them? That's the classic description of restless leg syndrome, or RLS, a neurological disorder that can wreck your sleep. This isn't just the fidgets, it's a deeply uncomfortable sensation that hits when you're at rest. Moving brings relief, but the moment you stop, it comes right back. While the exact cause isn't totally clear, we know it's strongly linked to two things: a problem with the brain's dopamine system, which controls movement, and not enough iron in the brain. And here's the interesting part. You can have normal iron levels in your blood, but still be low on iron in your brain, which is a key driver for many people. If this sounds like your nightly struggle, a doctor can order blood tests to check your iron and ferritin levels. If you're deficient, iron supplements can make a world of difference. Otherwise, certain medications can help. It's also a good idea to cut back on evening caffeine and alcohol. Warning sign 5. Waking up frequently to urinate. Waking up once a night to use the bathroom can be normal, but getting up 2, 3, or more times every single night? That's a condition called nocturia, and it's often a symptom of something more than just an aging bladder. It can point to obstructive sleep apnea, diabetes, or heart problems. Here's the fascinating connection to sleep apnea. When you stop breathing, the oxygen in your blood drops. This stresses your heart, which then releases a hormone telling your kidneys to make more urine to get rid of fluid. So the very thing that's waking you up, the apnea, is also what's making you need to urinate. Many people who get treated for sleep apnea are amazed when their nocturia just disappears. Another major culprit is uncontrolled type 2 diabetes. High blood sugar forces your kidneys into overdrive, pulling fluid into your urine and sending you to the bathroom more often. Don't just accept this as your new normal. Talk to your doctor about it, especially if you also have symptoms like snoring or excessive thirst. Treating the root cause is the key to better sleep and better health. We're halfway through the warning signs. If this video is helping you understand your body a little better, please take a moment to subscribe. It helps this channel reach more people before small health signals turn into serious problems. Warning sign 6. Drenching night sweats. Do you ever wake up to find your pajamas and sheets completely soaked, even if the room is cool? I'm not talking about feeling a little warm. I mean drenching sweats that make you change your clothes. While menopause and anxiety are common causes, persistent night sweats can also be your body's alarm bell for serious conditions. Think of it as your body's response to an internal fire alarm. Infections, from the flu to more serious ones like tuberculosis, can trigger sweats. Hormonal disorders like an overactive thyroid can put your metabolism into overdrive. And yes, night sweats are a known symptom of certain cancers, particularly lymphoma. They are also commonly linked to obstructive sleep apnea. The struggle to breathe causes surges in stress hormones, kicking your body into a fight-or-flight response that can trigger intense sweating. If you're having recurring, drenching night sweats, especially with other symptoms like unexplained weight loss or fever, please do not ignore them. A doctor can run tests to figure out what's going on and rule out anything dangerous. Warning sign 7. Physically acting out your dreams. This is one of the more bizarre signs, physically and sometimes violently acting out your dreams. This can mean shouting, flailing, punching, or kicking, and can lead to injuring yourself or your partner. This is not sleepwalking. It's a specific serious disorder called REM sleep behavior disorder, or RBD, and it can be a very early predictor of neurodegenerative diseases. Normally, during REM sleep when you dream, your body is paralyzed. This is a safety feature. In RBD, that paralysis fails because the circuits in the brain that control it are damaged. This allows you to move in response to your dreams, which are often intense and involve being attacked or chased. Research has shown with frightening clarity that RBD is often a precursor to diseases like Parkinson's disease or Lewy body dementia. In fact, studies suggest that up to 80 to 90% of people with RBD will eventually develop one of these conditions, sometimes decades after the symptoms first appear. If this is happening, it is critically important to see a neurologist or a sleep specialist. A sleep study can confirm the diagnosis. While there's no cure for the underlying process yet, treatments can help manage the dangerous nighttime behaviors and give you a huge head start in monitoring your neurological health. Warning sign 8. Grinding your teeth. Do you wake up with a sore jaw, a dull headache, or sensitive teeth? Your dentist might be the first to spot the signs of bruxism, the medical term for grinding or clenching your teeth in your sleep. Sleep bruxism is more than a habit that wrecks your dental work. It's often a physical sign of two key issues: stress and sleep-disordered breathing. When you're stressed, you hold that tension in your jaw. Even more importantly, recent research shows a strong link between teeth grinding and the body's effort to keep the airway open during sleep. For some, clenching the jaw is a subconscious reflex to prevent the airway from collapsing, a sign of sleep apnea. The force you exert while grinding is immense, leading to cracked teeth, gum problems, and TMJ disorders. Your first stop should be your dentist, who can fit you with a mouth guard. But remember, a mouth guard is a shield, not a cure. You have to address the root cause. That means managing stress and, crucially, considering the possibility of a sleep-breathing disorder. A sleep study could be a life-changing step. Warning sign 9. Consistently waking up too early. Most of us think insomnia is about not being able to fall asleep. But what about waking up at 4 a.m.? Mind racing, unable to get back to sleep? This is called terminal insomnia, and it's one of the most classic biological markers of clinical depression. The link is deeply rooted in our biology. Depression disrupts the body's internal clock and messes with stress hormones like cortisol. Normally, cortisol levels are lowest in the middle of the night and rise in the morning to wake you up. In people with depression, this cortisol surge can happen much earlier, jolting the brain into a state of high alert in the pre-dawn hours. This creates a terrible feedback loop. Depression causes poor sleep, and sleep deprivation makes the depression worse. Interestingly, one study found that shifting your sleep schedule just 1 hour earlier was associated with a 23% lower risk of major depressive disorder. If you're constantly waking up far too early, especially if it's coupled with feelings of sadness or hopelessness, please reach out to a doctor or a mental health professional. This isn't a willpower issue. It's a sign of a real, treatable medical condition. Therapy and medication can help regulate your sleep and address the underlying depression. Warning sign 10. Excessive daytime sleepiness. The final sign is maybe the most common and easily dismissed. Excessive daytime sleepiness. This isn't just feeling a bit groggy. This is a persistent, overwhelming fatigue where you struggle to stay awake in meetings, fight sleep while driving, or need naps just to function, even after a full night in bed. Feeling constantly exhausted is a massive red flag that your sleep is not restorative. It's the #1 consequence of the fragmented sleep from sleep apnea, the constant leg movements of RLS, and the early awakenings of depression. When your body doesn't get the deep, uninterrupted sleep it needs, your brain and body can't repair themselves. This severely impairs your concentration and reaction time, dramatically increasing your risk of accidents. If you feel bone-tired all the time, that is not normal, and you don't have to live with it. It's a clear signal that something is fundamentally wrong. Talk to your doctor and be honest about how tired you are. They can use tools like the Epworth Sleepiness Scale to measure it, and will likely recommend a sleep study. Finding and treating the root problem can give you your energy, your focus, and your life back. If any of these 10 warning signs sounded alarmingly familiar, please don't ignore them. Your sleep is a window into your health, and listening to these signals can prevent serious problems. Share this video with people you care about. It could be the wake-up call they need. And if you found this information valuable, please give this video a like and subscribe for more content to help you live a healthier life. I'd love to hear from you in the comments. Have you experienced any of these signs? Sharing your story could really help someone else. Thank you for watching, and here's to a future of healthier, restorative sleep.